In collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Charalambous.
First, let me wish you a very happy new year. Coming up this week, the government comes under fire for its controversial proposals to exempt some areas from the proposed Akamas National Park.
The big question here is, why are they trying to exempt the big chunks of land that are actually in environmentally very sensitive areas?
And we talk to our health minister about the delays in implementing the long-awaited National Health Service.
We have the public hospitals operating under the system, the modus operandi of the public service as well, which means that by 3 o'clock there is nobody in the hospitals to offer any service, other than emergency, that is.
The pristine area of the Akamas in the west of Cyprus is very important to anybody who loves our environment and nature. It has, or much of it I believe, has been a Natura 2000 site for many years, and for probably even more years there have been moves afoot to try and make it a national park. Well, this morning, outside the Houses of Parliament, or our House of Representatives as it's called here in Cyprus, a demonstration because the Akamas is under threat. Joining us on the programme is the Deputy Head of the Cyprus Greens, Effie Xanthou. Effie, tell us what this is all about and what is the threat to the Akamas, because I thought it was already protected.
Well, morning, Rosie, and thank you so much for having me on the programme. Basically, the government is trying to make little windows for people that want to develop huge developments like hotels, small marinas for yachts, for tourism. The whole idea that you're going to create a national park is something that they can't contemplate. For them, it's an area that is up for the grabs. So we're all protesting today in front of Parliament because the Minister of Agriculture and Environment is presenting his new plans for Akamas.
Have we seen those plans?
No, because there was a whole process. It took them like 7 years to create the plans. They had a big scientific team working behind it. They did all the public debates. They had all the meetings with the stakeholders, and they came up with a plan that actually accommodated both the creation of a national park and accommodated the locals, because we understand that you have local villages, you have people that have their properties there, and it was one of the biggest hurdles. They didn't want something that would take away their land. So the scientific team came up with a proposal. And when they submitted it to the Minister of Agriculture, suddenly there were changes happening, not based on any scientific facts, not based on the fact that you have a Natura 2000 areas and bird migratory patterns protected areas. And they're just taking big chunks and taking them out of the park because they belong to specific big money. And they want to develop those areas. So they're trying to exempt them from the park. They're stating that they need to exempt these areas because it's not worth the compensation that they'll have to give to these specific owners.
How legal is this if we look at it in European terms? Because the Natura 2000 and many of the other environmentally sensitive sites across Europe are protected, and if we do anything to destroy them, we are likely to have to pay an awful lot to Europe in fines. Has anybody compared whether that matches the compensation they'd have to pay to private owners?
They don't care about that, because that's one of the biggest arguments that we're having at the time. They already have a problem with the Natura 2000 areas that they submitted. They just weren't enough. So already we're under the microscope from the EU Commission, from the DG for Environment, because they don't think that we did a good enough job. So instead of trying to compensate and create this national park where you actually safeguard everything, they're actually trying to mitigate and minimize the areas that are going to be protected, stating that only national property, only government property will be a part of the national park.
Well, that means surely, I mean, we know that over the years, the villagers of many of the smaller villages there have looked at the development along the coast and said, hang on a minute, this isn't fair, we want to develop our property, and I thought that in many cases they had actually been given compensation already in order to not develop their properties because it falls within these areas. If this goes through, are they going to have a carte blanche to do what they like?
No. I actually think that if the inhabitants looked at these new plans closer, they would see that it's not actually in their favour. By exempting every single private ownership from the park, it means that they're only going to have agricultural land, no compensation whatsoever for the fact that it would be a part of a national park, but they won't be able to build, they won't be able to develop in those smaller areas that they have what they want, because it's agricultural land. You're not allowed to build on agricultural land, and I don't think that the zoning will change because of all the other European issues. The big question here is, why are they trying to exempt the big chunks of land that are actually in environmentally very sensitive areas? And we are talking about the westernmost posts of this area. They're trying to exempt those big chunks of land. The only people that are going to gain anything from the new plans of the government is big money. It's not the small villager that has a small plot of land that wants to build a house for their child and keep the family close to the village. They aren't going to be getting anything. The only compensation will be some public works for the villages, but that's not going to help each individual. By creating a national park, though, by actually helping them into an agrotourism plan, by allowing them to plough their land in a specific way, by using traditional methods and bringing the tourists in, they would be getting a lot more out of it. So, to our understanding, they took this scientific project that took 7 years to develop, to come by with all the combination of the knowledge from people that know what they're doing, and you have one minister changing the whole thing because he's been affected by specific interests.
But we did say at the beginning that you haven't actually seen the plans, so how do you know he's changed anything?
Well, we actually have seen the plans, but not directly. They're going to be presented today in Parliament, and we all know that already the minister has said that he is exempting every private owned land from that area. So we already know that the big areas, the big chunks that are very sensitive, and we've been fighting to keep within the national park for the last 25 years, he's immediately exempting them. We want to see the final plans as maybe he's changed them just to be sure, but that's what he's saying. He's saying that there is going to be no compensation towards private ownership, so they're not going to involve that land. So we're talking about pristine areas, clean coves that are right now in private hands, and they're going to be exempted from the national park. Well, what is somebody going to do with that? They're going to try and build. They're going to try and create roads to go towards their privately owned land.
And build hotels and whatever.
And build hotels and build whatever. We already went through this with the Anasa Hotel in the late 1980s. And we didn't manage to stop that because that was also a Minister of Interior trying to create his own hotel, and he managed to do it. But now, being within the EU and with all the directives and all the regulations that you have in place concerning environmental issues, this shouldn't be able to go through. And we know that there's going to be a fine coming over, and we know that they're going to have to do changes on the plans. But we have to think that most politicians just think short term. They just think we've got elections in 6 months, or we're going to have presidential elections in 2 years. They don't think through. They don't think what's going to happen after 5 years, after 10 years.
And that is Efi Xanthou from the Green Party talking about controversial proposals for the Akamas Peninsula. Coming up next, a lengthy chat I had just before Christmas with our Minister of Health.
Keep up to date with events in Cyprus and around the world with the Cyprus News Digest.
Our Minister of Health, George Bambourides, took over the ministry in July. And, of course, one of the first things he has to deal with is the implementation, yes, I'm afraid it is still ongoing, of the much-touted Cypriot National Health Service. George, if I can ask you how you go about doing this, because I have spoken over the last more than a decade, I suppose, to all of your predecessors who all say, yes, we're going to do it, it will be me that does it, and I remember Philippos Patsalis saying it would be in place by 2015. Here we are at the end of the year, and it doesn't look as if we've even got a date for 2016. What is the problem?
Right. Okay. The national health system was designed back in the end of the 90s, I would think, and a law was enacted by our parliament in 2001, setting out all the parameters of the system. It is modeled on the British system. We have our gatekeepers, the so-called GPs, who regulate the flow of patients from primary care to the hospital care. And it was supposed to cater for all the residents of the island, in the sense that it would be a universal system, and those who enjoyed the services of the NHS would contribute to its cost according to their capacity. Those who couldn't contribute would contribute zero. Those who could contribute would contribute to the maximum of their ability. In theory, it was a very, it made perfect sense, you know. Now, why wasn't it ever implemented? There are a number of reasons. One could say that the most important reason being the fact that almost 80% of our population is covered, so far as their health is concerned, by the services offered by our public hospitals. In other words, all public servants, including their families, but also all the people serving in the so-called semi-governmental sector, utilities, etc., including their families, are given free access to our public hospitals. Up until 2013, our public hospitals more or less offered a decent service, whereas a large number of the people insured by the public hospitals would not mind seeking medical cover in the private sector, because people were in general well off, and those who were quite rich would seek services abroad. In 2013, with the financial crisis, most of the insured people turned to the public hospitals seeking free services because of the financial crisis. So our hospitals were suddenly inundated by all those people who in the past chose not to seek the service they were offered in the public hospitals. And by doing so, they helped highlight the inadequacies of the whole system. It became apparent that the system was not up to date and was not able to offer the services that it was being asked to offer.
Are we talking here just in terms of numbers?
Not just numbers. It's mainly numbers, but you have to understand that we have the public hospitals operating under the system, the modus operandi of the public service as well, which means that by 3 o'clock there is nobody in the hospitals to offer any service, other than emergency, that is. So if you have all these mentalities in the public hospitals, you realize that you cannot be competitive with the private sector. So these financial crises, amongst other things, highlighted the need for
a total redesign, by the sound of it.
A total redesign of the modus operandi of the public hospitals, but also the need for the introduction of a national health system which would allow the patient to freely choose the health provider, either from the public sector or from the private sector. Because had there been a national health system in operation which would cover everybody living on the island and would grant all insured people the choice of their medical service provider, either from the private or the public sector, it would mean that all these long waiting lists, all these inadequacies of the public sector could be pushed out of the way because suddenly I would have the choice to go to the private sector and choose my own doctor, fix my own surgery date and get the service that I wanted without the requirement for any special adjustments that would be required in the public sector. So since 2013 the demand for the introduction of the NHS was increased tremendously.
But the other problem we've got, of course, is how we're going to fund it. And you mentioned at the very beginning that the vast number of civil servants we had and the people working in the semi-government organisations, they all get free health care without contributing anything. So you can't really expect people in the private sector to foot the bill for what many people would say were privileged members of Cyprus to get free healthcare. Why are we not all just paying a percentage of our tax so that this can be implemented sooner rather than later?
But this is exactly what happens now. You have all the taxpayers supporting only the civil servants and people working for the greater civil service in general, so far as health is concerned. So this has to be pushed aside. Let me just correct.
But is that not one of the biggest problems? Is this where the, if you like, stumbling blocks lie? Because it seems that every time we get close to doing something, interested parties, maybe you'll be able to elaborate on what other interested parties there are actually trying to stop this happening.
Well, let's see. If an NHS is introduced the way I described it, it means that every single employee in the country will be required to pay something around 2.5% of their salary. Also, every employer will also be required to contribute around the same, 2.5, let's say. And the state will have to contribute around 450 million per annum. That would make up a fund of around 900 million per annum. Now, according to our surveys, the health expenditure of the whole island is around 1.2. So by creating a fund which is able to cater for 0.9 of that 1.2, in effect you cover all the basic needs of the population so far as health is concerned. The rest would either be services not covered or upgrades, for example, hotel upgrades of the hospital business. Private room instead of a three bedroom, etc. But it's a no-brainer for me. You introduce it, you make all this money, which in effect is you double the expenditure on health overnight, and you provide your people with a decent standard of service. For me, it's a no-brainer. You have to introduce it, and you have to introduce it yesterday. Now, what's the problem with introducing it yesterday? According to our NHS, as it is designed, public and private hospitals would compete with each other for this 900 million. If I expose my public hospitals in the state of things as it stands today to an open competition with the private hospitals,
They'll lose.
They lose. They lose, and anybody who thinks that you can afford, a country can afford to do without its public hospitals, is foolish.
So we've got to change the whole design then?
Exactly, not the design. You have to change the culture, the ethos that actually under which our public hospitals operate today. And this is what I call autonomization. You need to create a new legal framework under which each hospital will operate as a profit center, as an individual profit center. Each director of a hospital will have to implement a budget, cost all the acts that actually take place in the hospital on a daily basis, and introduce the service providers in the culture of invoicing. You have to understand that you cannot offer a single service without invoicing. It doesn't make any difference. You don't have to invoice the individual who is actually receiving the service. You might invoice the state, who is the insurer, let's say, of that individual. But still, you have to put it into your culture that you need to cost and invoice every single act.
So how long is this going to take? Because the other thing we have to admit, I'm sure you will, but maybe you don't want to go on record, but everybody else would admit it, is the fact that particularly awkward very often when it comes to working hours, working weekends and all the rest of it, doctors in the public sector are not happy. They're very happy going home at the time that they do go home in the afternoon and so on. We've even had shocking cases in certainly the Paphos hospital of people refusing to come back into the hospital for emergencies. I mean, this is just not on.
Well, yes, but we have to be, we have to do our own self-criticism, and you can't provide your doctors and nurses with limited resources and expect them to do wonders. A doctor should be able to examine 20, maximum 25 patients per day. There are cases now that doctors are required to examine up to 50 or 60. So we have a lot of blame to take on that as well. It's not just the professionals. In order to judge them and be objective about it, you need to provide them with the minimum standard of working conditions that one should expect. But let's park that for a minute. What's important for me is that the health service providers that are employed by the state realize that if we leave things the way they are probably sitting on 13 containers for the health industry, to draw a correlation with Marie. This is not a sustainable situation. It's a disaster waiting to happen. The whole system will collapse. So if they fail to realize that, and they fail to embrace the effort of the state to reform the public hospitals...
We have another Cyprus Airways on our hands.
No, I don't think so. And let me tell you why not. Cyprus Airways was not catering for an industry where there were no other volunteers to cater for. Don't mistake the existence of a private sector in the health industry as tantamount to the existence of a volunteer to take over all the services provided by the public sector. Nobody would want to touch the chronics. The chronics are those who need the public service in the health industry more than anybody else.
Yeah, my comment about Cyprus Airways was really about the fact that the people working in the company, by refusing change, actually brought about its demise.
Yes, I can see that, but in the health industry, you can see how the private sector now already absorbs all my good professionals. They headhunt them, and they take them. I cannot sustain this brain bleeding from my health services. I have to start paying the good ones, and I have to start doing so by earning and increasing my productivity. I have the infrastructure to compete with anyone. Actually, I have much better infrastructure than the private sector. So I just need to utilize it. I cannot afford to have idle assets from 3 o'clock onwards. If I am to compete with a very vibrant private sector, I need to energize my public hospitals in order to compete, at least so far as a common modus operandi is concerned.
And how are you going to do that?
Incentives, carrot and stick. You cannot use anything else. You need incentives, and you need to be firm when the standards that you set are not met. You have to start kicking people out.
You had, when you first took office, the vocal support of many members of Parliament, but they too, over the years, seem to have sort of kept kicking this can down the road. What's your feeling about how they stand at the moment on this?
I don't care if they need to, you know, it's a time we face the music. We have no more time to waste. We're reaching the end of the line, and everybody will be called upon to clearly state their position on this point.
When are you going to be able to put forward whatever it needs to be put forward so that Parliament votes on it and things start to move? Because I'm sure that once you do put it forward and if it is voted through, that's the beginning of the new road. It's not the end by a long shot, is it?
I agree with you. It's a marathon which we haven't started running yet. We're just warming up for the last 14 years. So we should stop warming up and start running the marathon, because it's going to be a long process. And I believe that I will be in a position to present the rest of the political parties with our position within the first month of 2016.
And after that, how long do you reckon it will take before we can say that, yes, we're all paying our contributions, and if you're ill, or if I'm ill, or if anybody's ill, they can go to their nearest medical centre or government hospital and see a doctor?
I cannot put my finger on a number, because let me tell you why. I'm not dodging the question. I can give you a time frame if you want, but what I want to share with your audience is that the test is a substantive one. I will be ready to proceed with the NHS the moment that I feel that my public hospitals are ready to face competition with the private sector. And to be honest, I don't see that happening earlier than 2, maybe 3 years after autonomization is implemented.
And the automatization will take how long?
That's what I'm saying. It will take 2 to 3 years.
Well, there you have it. We'll wait another couple of years, but hopefully this time it really is in the making. Thanks to Health Minister George Mamboridis for joining us on the Cyprus News Digest. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.